Welcome to this morning's discussion, Tackling Diabetes, Solutions to a Complex Disease. I'd like to thank Pharma, our sponsor, for enabling us to have this conversation. Diabetes is on the rise across the United States, posing a significant healthcare challenge. Currently, the 7th leading cause of death in the country, it could affect as many as 1 in 3 American adults by 2050. This complex set of diseases also comes with a hefty price tag, $245 billion a year in medical costs and lost productivity. We will hear from lawmakers, medical experts, patient advocates, and health industry leaders this morning about what we can do to prevent and improve the management of the disease, ensure access to quality care, and address disparities to improve outcomes for at-risk and underserved communities. Before we get started, just a few notes of housekeeping. In addition to those of you here in our studio today, we are also live streaming at thehill.com. We ask that you just turn your phones to silent, but we encourage you to join the conversation on social media, and you can follow us at The Hill Events and comment using the hashtag DiabetesSolutions16. I'd now like to invite William Chin, Executive Vice President of Science and Regulatory Advocacy at Pharma, to offer some brief remarks. Bill?
Thank you, Joanna. Good morning, everyone. On behalf of Pharma, I'd like to welcome all of you and thank you for joining us. Today, we'll be talking about diabetes. It is an old disease. Some say that it was first discovered about 1500 BCE. Now, more than 3,500 years later, this disease still endures, continuing to afflict 1 in 10 Americans. Chances are you know somebody with the disease, or maybe you yourself have it. I'm an endocrinologist, so as an endocrinologist, I've spent years in academic and industry laboratories working with some of America's finest researchers to identify better, more powerful treatments that might be unleashed against this disease. As a father, I've seen the fruits firsthand from a patient's perspective of that research and treatments my son has used since he was first diagnosed with type 1 diabetes back when he was 15 years old. And by the way, when he first told me about his symptoms, I said, "Son, you couldn't possibly have diabetes because I'm an endocrinologist." Well, the truth is he does. Disease is an equal opportunity provider, I'm afraid. I've seen it in the therapeutic benefits that America's 30 million diabetics have today. But until we find a cure, our work continues. The good news is that there's increasing hope for patients. I'm pleased to report this morning that America's biopharmaceutical companies currently have more than 170 potential new medicines in development for diabetes and diabetes-related conditions. These are treatments for both type 1 and type 2 diabetes and the related chronic kidney disease. Successful treatment for type 1 and type 2 could lead to fewer emergency ward visits and decreased hospitalizations. They could also help reduce complications such as diabetic neuropathy, cardiovascular disease, blindness, and even death. Some are in phase 1, others in phase 2 and 3 in clinical testing. Some are already under review by the FDA. Now, each of you found our report on progress against diabetes on your seats. For those who are streaming this event, please visit us at Hope to Cures, that's one word, hopetocures.org, to download your copy. We're proud of diabetes innovation and look forward to building an even larger arsenal of treatments. These medicines are the products of many people, many of whom work in obscurity. They are also the product of leadership. I want to thank Congressman Tom Reed of New York, who is here with us this morning. He is the co-chair of the Congressional Diabetes Caucus. the largest caucus in Congress, and Congresswoman Robin Kelly of Illinois, who is chair of the Congressional Black Caucus Health Brain Trust. We look forward to hearing from her in a moment as well. Momentum is building against diabetes and many other diseases. We appreciate Congress's focus on 21st century cures, and we look forward to learning about the innovation agenda of the incoming administration. The transition team's statement, which encourages FDA reform in order to, quote, put greater focus on the need of patients for new and innovative medical products, end quote, is encouraging. A disease as merciless as diabetes deserves nothing less than a 100% collaborative and comprehensive approach. Because while diabetes has evolved to elude the world's researchers for many years, so has the science that has evolved as we're applying to try to finally catch it. We need the best minds harnessing the scientific firepower to beat diabetes once and for all. We know we can't do it alone. Collaboration is critical. Our industry is proud to work with diverse stakeholders to reveal the underpinnings of diabetes and foster new ways of continuing it by developing and delivering novel medicines, such as new biomarkers, patient-reported outcomes, such as personalized precision medicine with the use of innovative clinical trial designs. We need better evidence requirements for both preclinical and clinical development to reflect the rapid pace of science and the shift to increasingly patient-focused drug discovery. We also need a predictable and transparent regulatory system with greater clarity in how these novel drug development tools are qualified to help ensure that research and development can keep pace with the evolving science. The focus on the patient must continue through the delivery of new medicines as well. And finally, coverage and payment policies must also continue to evolve. This is necessary to keep pace with the scientific advances and ensure the delivery of high-value care for patients. I'm sure we'll hear other ideas from our speakers and panels later on this morning. So to conclude, we believe there is one way to help end so many years of diabetic suffering. We must enact unprecedented, pragmatic policy solutions that push forward scientific discovery and the development of cures. Your loved ones deserve it. My son deserves it. All of our patients deserve it. Thank you again for joining us, and I hope you enjoy this morning's program.
Thank you, Dr. Chin. Our first speaker, Republican Congressman Tom Reed of New York, is the co-chair of the Congressional Diabetes Health Caucus in the House, and he works to raise awareness for the disease. He also has a very personal connection to it. His son has type 1 diabetes. Joining him is my colleague, the Hill's national correspondent, Reed Wilson. Over to you, Reed.
Thank you, Johanna, and good morning.
Good morning, everyone.
Being here. Thank you, Congressman Reed, for taking time out of your busy morning. Johanna mentioned your personal connection to type 1 diabetes. Tell us about how that has impacted your career as a lawmaker and especially your focus on the disease.
Well, thank you so much, Reed. And I love those socks. Those are perfect. Well, thank you, everybody, for getting up early this morning and joining us on this important issue. And as has been stated, this is something that is very personal to me and to my family. Reed, as you know, my son Will, my youngest. I have two daughters, 18, and my son's 16 now. But Will was diagnosed at 4 as a type 1 diabetic. And I've heard this story, and you've heard the story, and I just heard it again from our good friends with Steve, with Pharma, who have gone down this path. And I'll never forget the day that I got the call. We took him to the doctor. Doctor says you have to go to the emergency room. We immediately got over there, and I literally had to hold him down as he looked at me with tears in his eyes. And he said, "Daddy, why are you letting these people hurt me?" Because they were administering insulin to him to get his number down from, I think it was at 700, down to something that was more acceptable, obviously. And from that day forward, our lives changed, as so many millions of Americans and people across the world have been impacted by it. It's a 24/7 disease, 365 days a week, and I'll tell you, we just got to continue to raise the issue of awareness, raise the issue that this disease, so many people think, he'll outgrow it. If he just doesn't eat candy, everything will be fine. There's so much misinformation still out there, but we've come a long way, and I'm very excited about the opportunities that lay on the horizon for us to take this disease on and cure it. That's the ultimate goal.
Let's talk about some of those opportunities, especially from Capitol Hill's perspective. We've seen the rising costs of treatment, including insulin, which harms accessibility for a number of families across the country. How can Congress address that specific issue and lower costs?
Well, obviously, I'm always the optimist in the room. I got 11 older brothers and sisters, and my father passed when I was 2, and my mom taught us early that you could either develop a chip on your shoulder or you could look at life and the opportunity that it is and treat people with respect and go forward in a positive way. And so I look at this new administration as an opportunity as we deal with the healthcare replacement package that will be coming down the pipeline as to how we can get the issue of cost under control in healthcare and make really healthcare available and accessible and affordable as we go forward. And you do that through reforms that I think that are going to be coming down the pipeline that push transparency, accountability, and to provide a individual and a doctor-based type of reform that's coming down the pipeline as we speak. But as we deal with the issue of cost, I will tell you I'm excited about the opportunities on the horizon that we saw with the artificial pancreas just being approved by the FDA, and 21st Century Cures was referenced in the introductory comments. Those are great reforms that are going to speed up the process of getting these cures, getting these new treatments out into the public to do what they are designed to do, help our fellow citizens.
You touched on a number of things that I want to get back to. Let's start with the ACA and the Republican effort to repeal and replace it. You're also a member of the Trump transition team. And by the way, the co-chair of the Congressional Diabetes Caucus, those all come together. How do you make sure that the Republican replacement for the ACA doesn't kick a bunch of people off doesn't hinder their ability to access the drugs they need?
Well, obviously, I think we all join in the effort to make sure that healthcare is accessible and available to all of our fellow American citizens. And so as we go through this repeal replacement process and serving on the Ways and Means Committee, where a lot of the healthcare reform package will be originating, coming out of our committee, I'm very excited that what we're going to see is a replacement that is going to get to one of the critical pieces that I think we've missed, and that is the healthcare cost equation. Not just health insurance reform, and I think there's a lot of broad bipartisan support to accept a lot of the insurance reforms that you're referencing that people may be concerned about, pre-existing condition, issues like children being allowed to be carried on their parents' policies up to the age of 26. Those types of reforms I think can form the cornerstone of an insurance reform package. But then we have to go to the next step. And that's going to be the devil's in the details, obviously. But we're going to continue to push forward with a replacement that puts the cost equation into focus.
Is there anything specific that you'd be concerned about when it comes to the Medicaid expansion element of the ACA? I mean, that's, a lot of people get their drugs that way.
Well, obviously, and coming from a state that has a Medicaid potential exposure, I think, of 3.2 or 2.7 billion. I have so many numbers off the top of my head, so bear with me on that, Reed. But that would be a huge budgetary shortfall to our state capital, but also to the people that it represents. So I think as we go through this process, it will be a collaborative process. It will be something where we're looking to find solutions. People like myself who are here to get things done, really try to create that environment as we go forward. But also at the same time, being the co-chair of the Diabetes Caucus, we're going to make sure that the issues of diabetes are part of that conversation. Because if we could continue to focus on policies that put the issue of curing diabetes, treating diabetes, keeping it under control, keeping your A1Cs at a level, then you don't have all the complications that come with it. And from my perspective, that's a great quality of life outcome, but it also helps, obviously, on the financial bean counting equation that's so important here in Washington, D.C.
Mm-hmm. You mentioned 21st Century Cures as well. There's not specific funding for diabetes research in the measure, but it could help.
It could. I mean, you look at the FDA reforms and how they're really pushing bring new cutting-edge technology out into the market and to get to patients, to get to folks that need the potential cures quicker, faster, more efficiently. I think those are solid reforms, and kudos to Fred Upton. This is his legacy bill, and I'll tell you, I was so proud to be on the floor with him, and he had tears in his eyes. I mean, this is years of work that he made a priority, and it's going to impact lives for generations to come.
Let's talk about some possible legislation that might come up in the 115th Congress. You have a measure, the Medicare Continuous Glucose Monitoring Act, Access Act. Tell us about it. Tell us, and what are its prospects?
To me, this is common sense, and maybe we lose some of that in Washington at times. But you know, making sure that the continuous glucose monitoring system is available under Medicare, and making sure that that is covered as a reimbursement policy, because you know this is technology that really keeps the disease in a much better situation. And as I argue with CMS and I argue with folks over in D.C. on these issues, you know, why wouldn't we allow this? Why wouldn't we bring the best treatment to people so that you don't have all the complications that come with it? That makes sense to me. And so, you know, we have 200, I believe, 280 co-sponsors, a special diabetes program. We have 340 co-sponsors on a letter where we have sent the message that there's huge bipartisan support to enact these type of priorities when it comes to diabetes. And I'm confident, having the position we do, that this issue is something that we're going to advocate for and use the position to help millions of people across the country be in a better position.
You're also on Pete Olson's National Clinical Care Commission Act. What are that measure's chances in the 115th?
You know, I think Pete's doing great work on those issues, and I think those are the kind of reforms that could be part of this replacement package that we see coming down the pipeline.
Do you have you had conversations with Republican leadership, with the committee leadership about advancing any of these in the next few months?
We have, and they know our position very well, as we've been advocating on these diabetic priorities for years. Being the co-chair of the Diabetes Caucus, Diana DeGette and I work together very well. She has a similar personal story with her daughter, and you know, these that brings together a force. And anytime you can get 300 plus, the largest caucus on the Hill, 300 plus members that are speaking in one voice, that gets attention. You've been around the city much longer than I, Reed, and I'll tell you that does get attention, and leadership's aware of those numbers too.
Back to 21st Century Cures for a minute. The measure speeds the FDA approval process, as you mentioned. Where's the balance between making sure a treatment gets to market and protecting the patients who might be harmed by a treatment that's not as effective as it could be?
Yeah, that's exactly the balance, and that's where you have to trust the research, you have to trust the science, believe in the science, and make sure you're balancing the risk with the outcomes that we're trying to achieve. But when you look at some of this technology, especially when you see the European market, for example, with the artificial pancreas and the leadership that they've done, and you see the results that are coming out there, I think we need to make sure that we're always taking in all different aspects of information when it comes to the research, and making sure that we're putting out cures and treatments that are going to help people. But at the same time, you got to have that oversight. You have to have that double check on the system to make sure that people aren't going to be harmed by bad science. And that's something that it's never going to go away. It's always going to be there. That is the battle that you have to do in these oversight reform packages as they come out.
You've mentioned the artificial pancreas a few times. What else is on the horizon that you're excited by in terms of diabetes research?
Well, you know, you look at things you see on the stem cells situation, the artificial pancreas, and the next evolution to that, internalizing the devices. I mean, the research that's out there is just amazing. And then the whole concept of what really causes this? What really causes this? I've had doctors in the office, JDRF and American Diabetes Association do great work, and they bring in some of the best and brightest minds, and really trying to understand, you know, from genetics, from the genome, is there ways that we can potentially gene therapy, use the body to cure itself? And it's almost like Star Trek.
Yeah.
Some of the stuff that comes in the office, it is so amazing to be part of that, and we need to highlight it, promote it, and get it out there.
So, what is Congress's long-term role in doing just that?
To make sure that the prioritization of the research is funded, that is there. And these are the honest debates that we have to have, Reed. We have to have them across the country. I mean, we do. I mean, I came here in 2010. I'm a Republican member. I'm very fiscally conservative in my policy and my philosophy. But we're going to be making investments, and we have to make sure we're making investments on a priority basis. And this is one of them. This is one of them that I will challenge any of my colleagues. If we can cure diabetes, you know, the impact on lives that we're talking about, but then also the financing of it, it's a win-win. And they can't argue with that. And so have this open and transparent conversation about priorities, and you're going to see the investments come, and you're going to see the investments stand.
Mm-hmm. When you're talking about investments, who is in whom are you investing? Is it NIH research? Is it public-private partnerships?
All of the above.
Yeah?
All of the above. I'm open to the best and brightest minds, wherever they may be.
Mm-hmm.
You're going to have obviously public leadership in it, NIH and others, but you're also going to have you know, the private sector. The research laboratories and the universities and colleges and the medical schools that are out there, making sure that they're all coordinating together. And that's where, you know, we're talking to Fred Upton and 21st Century Cures, you know, that there's a need to make sure that we're leveraging as much of that private dollar as well as the public dollar to get to the solutions we're looking for.
Gotcha. As a member of the President-elect's transition team, have you had any conversations either with Congressman Price or with the transition team itself about his priorities going forward in terms of drug pricing, in terms of research funding, anything like that?
Yeah, well, I think Tom's, you know, I serve with Tom on the committee. I think it's a great pick to be in the role that he's going to serve in the Trump administration. And, you know, he is focused, he's a doctor. He's a doctor at heart. And so he's focused on patients. Mm-hmm. But at the same time, he realizes that, you know, we have to get the healthcare cost equation under control. And he has done yeoman's work in putting together a package that you're going to see carried on the Hill in the House, especially in the House Republican caucus, that are going to bring those reforms into legislation. And now to have a partner at the Secretary of Health who wants to embrace and engage in that conversation, I think it's going to be hopeful and optimistic that we're going to get some positive results.
Mm-hmm. As the co-chair of the Congressional Diabetes Caucus, the largest caucus on the Hill, what sort of role do you play in educating fellow members about these issues?
That's what Diane and I do a lot of. Yeah. Really just sitting on the floor, talking to folks, and hearing these conversations about folks, type 2 diabetes, type 1 diabetes, and they don't understand the difference. They don't understand, you know, how the disease is still with us. Mm-hmm. So much misinformation, and these are members of Congress, and not to fault them. It's just these urban legends that continue on. And so what we do is we take the opportunity. I mean, again, being a family of 12, I talk to everybody. I'm just known around here as the guy who talks to everybody because I enjoy it. I enjoy having this conversation and educating people as to the issues that we face on a day-to-day basis. And you know, once you tell the story, they get it, and they don't forget it. Yeah. They get it, especially when people come up on the Hill. And they see it reinforced by their constituents. They see it reinforced by the kids that come up. One of the best ambassadors I've ever had in my office is the JDRF ambassador. She is just a wonderful breath of fresh air when she comes in the office. She has her own little chair. I put her up there, and she got her picture in our office. And those stories connect with members in a way that are more powerful than any report, any study that are out there, because they remember those faces and they remember the pictures of the kids and the people that they're impacting. Mm-hmm.
And last one for you, are we going to have a cure for type 1 diabetes in our lifetime?
You better believe it, if I have anything to say about it. And there was a doctor when we were with Will in that first year, and he's like, you know, Tom, they're gonna cure this. I'm very confident within 5 years. Mm-hmm. Well, that meant he would have been 9. That was 7 years ago. So I should have got that in writing. But we are going to cure this, and at least make it a treatable disease that is much more manageable, much more taken care of by the technology and the treatments that are out there. So I'm very optimistic. And when you talk about the American innovative spirit, it's going to lead the charge, and it's going to come from us, and it's going to impact and change the world. And that's what a cure will represent, and that's why we continue to fight for it passionately.
Yeah. All right, Congressman Tom Reed, thank you so much for taking the time.
Thank you. Thanks, Reed. Appreciate it. Have a good day.
Thank you to the Congressman.
Thank you.
Next up is Congresswoman Robin Kelly from Illinois, and she is the chair of the Congressional Black Caucus Health Brain Trust. In 2015, she compiled a report focusing on health disparities in America to push for policy initiatives that will improve health outcomes. And Reed Wilson will also be conducting this interview. Over to you, Reed.
All right. Well, thank you, Congresswoman Kelly, for being here. We very much appreciate it. Johanna mentioned the Kelly report on health disparities. Start by telling us about that. What'd you find?
Well, what I found was a number of things. Not enough money invested in the prevention of diseases. That of the top 10 diseases that people die from, African Americans lead the way in 8 out of 10 diseases, and diabetes is one of them. Even though we've come a ways, but there's still so much to be done in clinical trials and diversifying the diversity pipeline as far as doctors, nurses, all kind of positions in the healthcare field, and also that people tend to do better when they have healthcare folks that look like them. So a number of things.
How has the representative healthcare field changed in the last few years? I mean, has the ACA helped it?
I mean, I still think I think the ACA has helped as far as diversifying the pipeline. But the problem is the expense of becoming a doctor and going to college. That stops a lot of people too. I've met with doctors and dentists, and their bills are outrageous, $300,000, $400,000. My husband is a doctor, and even though he's not here, so old doctor, he's been a doctor a long time, and it took him many years to pay his bill, and his bill is nothing like what the bills are now. So that impedes people also.
So magically, in the 115th Congress, you get the chairmanship and the pen to write the legislation to fix these disparities. What would you do?
I think a number of things, more investment in research, more investment in clinical trials, access to healthcare, and also education. Because when you look at things like diabetes, let's just say, people being overweight, and just more of the cultural things that we need to look at also. And I always believe in prevention is the cure. So more money on the front end, and also discussing with people, kids in school, parents, and all of that, and to see what they can do to stop the continuation of this disease. But definitely more investment in cures, and even more investment in people that will take on this endeavor.
We've seen there's a political atmosphere at the moment in which voters are broadly skeptical of the federal government's involvement in things like Common Core and education funding. Given that, what is the appropriate federal role in that front end education and prevention?
Well, it's interesting because there's an organization that we work with, and they try to do a lot around clinical trials. And it's so hard to get people of color into clinical trials because everyone goes back to Tuskegee. But if we don't have a variety of people in the trials, it's hard to come up with the medicine that will be the cure.
That's fascinating that there's that sort of cultural stigma has lingered for so long.
And I know, and just like you said, people are skeptical, but it's so very important.
Talk about the 21st Century Cures Act a bit. How is that going to advance both diabetes research and that front-end education effort that you talked about?
Well, I should be on the committee. I went to Cuba with Diane DeGette and the committee to see what they do in Cuba. But I think 21st Century Cures will be important in dealing with, just like things I said, just education, trials, just investment in what's needed for the cure of diabetes and other diseases also.
Every major bill like this is still just one step. What's the next step after 21st Century Cures?
Oh, there's so many steps. Well, we have to get the bill signed into law and all of that, but I think that we have to continue working with, it's not just the legislation, it's the healthcare field, the pharmaceutical field. We all have to be at the table together to keep research going and those types of investments going too.
You were a member of the state legislature before you came to Congress. Talk a little bit about what does diabetes, what kind of impact does a disease like type 1 diabetes have on a state budget? Now, I mean, we talk a lot about the federal budget, but what about the state side of this?
Well, when you look at particularly where there are neighborhoods or communities or districts or wards of people of color, there's a tendency that they use the emergency room more because they don't have the maybe the know-how, the resources or whatever to keep up with their medicine follow-up or access even. I mean, that's a tremendous amount going to the emergency room to take care of your ills instead of going to, having steady appointments with the doctor. Or even the other thing is, when you look at, I represent the Chicagoland area, the idea of food deserts, where there was a study done, be it a while ago, that people could get McDonald's before they can get an apple. So that all has an impact on how healthy a person is, and then they're going to the emergency room, then there's not the follow-up. So that does hurt economically. And then even, people missing work. It just all adds up.
And it can become a burden on the state of Illinois, on the city of Chicago, the county of Cook,
Right, and like Cook County has a hospital, and just the number of people they're seeing at hospitals, and it is, according to statistics, higher among people of color going to the emergency room or recidivism and that kind of thing.
You've talked about the rising costs of specifically education and access to health care. Drugs are becoming increasingly costly as well. Some on the left, Bernie Sanders, Elizabeth Warren, have called for investigations into the rising cost of insulin. What's your take on Congress's role overseeing that marketplace?
Well, I definitely think we need to keep our eye on the prize and I'm on oversight and government reform, so I do think we need to investigate it, and then, but also, like you have some companies, like we just heard, that raise prices tremendously, but then because I'm on the Brain Trust, I speak to a lot of companies, and I do know that to do research, it costs a lot of money, and that, the first time around it may not work, and you have to keep trying and trying and trying, so that costs money, and to pay people and to do the research. So, we have to find the middle ground, so it's not so tremendously expensive so people can't even afford the drug once the clinical trials are successful. There's some, I guess, compromise.
Is it appropriate, though, to haul a bunch of CEOs in front of oversight and government reform, or?
Well, I mean, I don't think there's anything wrong with, I'm not saying we should condemn them, but I don't think there's anything wrong with having a dialogue, and this is their way of keeping us abreast of what's going on also, or their opportunity to tell us maybe what we can do or what needs to be done. There's nothing wrong with educating us also.
115th Congress, Republicans will have control of both chambers and the White House.
I know.
As they prepare a replacement for the Affordable Care Act, what are you going to tell your Republican colleagues, especially on an issue like diabetes and minority access to health care? What does their replacement need to include to essentially prevent people from being kicked off Medicaid?
We need to remember that we're in Congress representing real everyday people, and they're not real everyday wealthy people. And we need to look at the good things that the Affordable Care Act has done, because frankly, all we've done, in my opinion, is try to repeal it. We've not had discussions. Maybe some people that are friendly in some corners, but we have not had a discussion in Congress, at least since I've been there. How can we improve it? No one said the bill was perfect, but we really haven't discussed how can it be improved. It's just been, let's get rid of it. So, I mean, of course, pre-existing conditions, keeping your child on to the 26, women shouldn't pay higher than men, just those things that have been working. And a lot of people, whether they like it or not, are on the Affordable Care Act. I think I was meeting with my farmers. My district is urban, suburban, and rural, and they talked about what small business has to deal with. So we need to look at that. But I think the Affordable Care Act has insured so many people that didn't have insurance. And I know small businesses that their prices have gone down and they could insure their customers, their employees and the family. But I think we have to keep those things in, and we have to have something to help with research and prevention. I think is very, very important.
Let's talk a little more about diabetes specifically and its impact on minority community, underserved communities. What can Congress do to fix that in the long run?
Well, I still think it goes back to education and prevention, and also there's so many things. Access to places to go for people with diabetes, that's one of the problems. So access to health care to close the disparity gap, but the person still has to get there. So I think prevention, also diversifying the diversity pipeline, so that goes into how expensive it is to get training and to go to school. I don't think there's just one thing. I think a lot of things lend itself to it.
Yeah. It sounds like you're talking about a generational solution, something that's going to take 10, 15, 20 years to fix.
I hope not, but it looks like it, because in the African American, but not only the African American community, the Native American, Latino community, it's an issue in communities of color.
Mm-hmm. Mm-hmm. Okay. As 21st Century Cures wraps up, what are you looking for in the 115th Congress? What can you work on with your Republican colleagues to speed cures, speed research, speed access?
That's such a hard question, because I'm so proud of what Diane DeGette and Congressman Upton has been able to do, and that is a big caucus. But I think that's diabetes. We need to look at as many diseases as possible in the way that people have looked at, diabetes, heart disease, stroke, cancer, to see how we can work together in curing all of those diseases, or get us closer to curing those diseases.
Do you think there will be a cure for type 1 diabetes by the time you're out of Congress?
I'm going to say yes, because I don't know how long I'm staying.
That's a very good answer. I like that. What kinds of a legacy is President Obama leaving on issues of research and development? Set aside the Affordable Care Act, 21st Century Cures will get his signature, but what sort of legacy is he leaving on these issues?
I think he's leaving a positive legacy. Presidents have talked about for a long time universal health care, or what we can do to have a healthier nation. And I think that he certainly, it didn't solve everything, but that he definitely has the country headed in the right direction. And I think that even though, yes, the Affordable Care Act isn't perfect, but some of the other things, like 21st Century, like the HEA bill, the Health Equity Bill, that the Affordable Care Act took some things out of that, and that's about closing the healthcare gap. So I think he has a good legacy. My fear is that this next Congress, are we just going to try to, I don't want to say destroy, but change everything that he's tried to do? Hopefully, we're not going to take a step backwards. But in listening to President-elect Trump, I know his campaign rhetoric was, it's gone the first day. But since he's won, it seems like he's walked back some of the things. It does concern me, frankly, who he is putting in charge, since he's been one of the engineers of repealing the health care altogether. But I haven't seen what they want to replace it with.
You're talking about Congressman Price.
Right. Okay. And I haven't seen what they want to replace it with. And I'm sure, there are good ideas, and I'm a negotiator and a mediator and believe in collaboration. So I'm hoping that whatever they want to put forward is just improving on what we already have, and looking at where maybe people have complained and that we can improve upon, but not just take it away.
Yeah. And I'll ask you what I asked Congressman Reed. 21st Century Cures dealt with the balance between speeding treatments to market and protecting patients. Did the bill go too far in one way or the other? Where is the balance there between protecting patients and getting something to market in an efficient manner?
I think there's a balance, but I guess I'll tell you time will tell, because it's hard to say at this moment.
Yeah.
But I mean, I want to get the solutions to the patients, but also I don't want to get things that quick, so quick, where we're saying, like when you see commercials, some commercials now, nothing against anybody, but take this pill, but then there's a whole minute of, but it might do this, it might do that, it might, so that we can be more sure of the treatment and how successful it's going to be. But again, we need a variety of people in the clinical trials, so the companies know.
Yeah. All right, Congresswoman Robin Kelly, thank you so much for taking the time.
Thank you.
Thanks, a lot.
This